Right now, we pay about twice as much per person what most other developed countries pay for health care. Our total annual health care expenditure is around $3.5 trillion. We also pay higher prices here, over $1,000 for an MRI scan and $40,000 for hip replacements. We also pay about twice what people in other countries pay for prescription drugs. And most of our doctors are paid more than doctors in other countries. But what's an even bigger factor in our total healthcare costs is administration. We now have an entire industry of healthcare administrators. Nearly 2 million people working in hospitals, doctors' offices, and insurance companies who file claims, deny claims, appeal those claims, approve and deny proposed treatments, all part of negotiating healthcare costs. Most of this bureaucracy resulted from a well-intended effort to control costs called managed care. But now it has become a primary contributor to those costs. Of the $3.5 trillion that we spend on healthcare each year, nearly 1/3, $1 trillion, is spent on administration. Those are dollars that are diverted from the actual delivery of healthcare. This is the elephant in the room. While we do have many outstanding doctors and hospitals, and while some foreigners come here to seek those out, we don't look so good overall. First, most of those other countries that spend on average half what we do per person provide health care to all their residents. They consider that a moral responsibility of good government. Even after the improvements of the Affordable Care Act, also known as Obamacare, we still have around 30 million people, almost 1 in 10, with no health insurance at all. Another 40 million of us suffer from being underinsured. Over half of the household bankruptcies in the United States are due mainly to medical bills, and most of those folks had some health insurance. As for the uninsured, you might say, well, people without insurance can always get treated in emergency rooms. They can, but they typically don't resort to that until they're really, really sick and require much more expensive care. An emergency room is the most expensive place to get treated. And the costs of that uninsured treatment are passed on to the rest of us in higher premiums. Among developed nations, we're at or near the bottom in most outcome measurements. We have the highest death rates of mothers and infants. Our life expectancy lags behind most other countries. People live longer than we do in Slovenia, with an average income less than half of ours. We pay the most and we get far less. We believe we can do better. It's called Improved Medicare for All. Everybody in, nobody out.